Hi everyone, it's Tammy. I just did a video and I have to do it again. I didn't realize I had the audio on mute, so okay, I gotta keep an eye on the clock because I did one earlier and I babbled and babbled and it was rejected. It was just too long. Okay, my stay at Humber River was absolutely miserable. The nursing staff, most of them unprofessional, did not know their jobs, did not know how to do their jobs. I had difficulty with my IVs. My veins were shutting down every other day. Stress, dehydration. And a lot of the nurses didn't know how to put them in. They were using terms like I have one here. I don't know if you can see that. Lovely bruise. It's healing pretty good now, but she went right through the vein. In one end, out the other. Oops, I burst, what'd she say? I burst the vein. And then the other one's putting one in my hand. She's like, oh, no, 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 no. Oh, it popped. These are not words of encouragement. These are not words to build trust. And this was after everything had already happened. I'm already super sensitive. Like my skin, my whole body just started to react to everything. Taking off bandage tape was torture. The sheets felt like sandpaper on my skin. I had to sleep on my fuzzy blanket my husband brought by the hospital. I became super sensitive to everything. I cried every time a doctor walked in the room, or a nurse, or just, oh, it was terrible, terrible. I was on Cymbalta before the surgery, and I figured a day or two I'd be fine off of it, but this turned into 2 weeks. And being ripped off of it, and going through this emotional roller coaster, it was too much. It was definitely too much. To say I was traumatized doesn't cover it. I had nurses that didn't know how to use the IV machines. There would be 3 inches of air bubble in the tube slowly making its way to my vein. And I'm telling the woman, take the air bubble out. Oh, it'll disappear. Yeah, sure it will. Inside my body. To my heart. You know. The feeding tubes, the woman didn't, well, a lot of the nurses didn't know how to use the feeding machine. They didn't know how to properly flush. They didn't know how to dilute the protein syrup so that it wouldn't clog my feeding tube. There was feeding fluid on the floor because one nurse had put so much pressure on the tubes to push the blockage through that it burst the tube open and food went everywhere, the liquid food. And another nurse, the one with the air bubble, she put IV fluid all over the floor. Nobody bothered to clean it up. And it's right between the 2 beds where I have to unplug and stand to go to the bathroom. So, you know, slip hazard. Anyway, it was horrible. I left the hospital with names and numbers. I intend on writing a very long letter to as many people as I can. Something's got to be done. Humber River is building a new hospital, and it seems that all their resources and focus have been diverted to that and not in taking care of patients, even though the hospital is still very active. I could go on and on about it. They should not be doing this surgery. You know, if your emotional state is the way mine was, how can you heal? You know, you can't. The last day, when I finally got to come home on September 6th, my first surgery date was August 25th. I came home on September 6th, and when my surgeon walked in the room, I started crying. I was just waiting for him to tell me that I wasn't going home. And by that point, I was pretty much broken. My spirit was broken, and I was ready to go. Thank God he let me leave. He pulled that tube out of my throat and took the IV out, and boy, I was packed and ready to go within 20 minutes. My weight, I I realize I haven't ever done this. I chose July 28th, the first day I met the surgeon, as my start date, and my weight was 220 at that time. Sorry about that. Today is September 16th, and my weight is 190.6. That's a good weight loss so far, and the best thing about it is that I lost most of it on my own, with the pre-op shakes and practicing mindful eating, portion control, that sort of thing. So I'm quite happy with that. That's about 30 pounds, but I lost 5 pounds about a week or two before this date, so it's like 35 pounds. I'm quite happy with that. Food, recovery, and gas. I'm recovering okay. It's a little slow. I have the J tubes in me, so it feels like it's sort of slowing me down. I can't get back to normal. Sleeping is uncomfortable. I'm always reminded that these things are here, and that they have to be milked and cleaned and bandage changed and all that sort of stuff. And can't just jump in the shower whenever you feel like it. I have to plan it around the nurse coming, so that she can clean up the site. The moisture helps loosen any hard, what's a nice word? Can't think of any nice word. Pus? So it's soft for her to clean it away when she gets here. I find that's better. Otherwise she just leaves it, and that's gross. I want it cleaned away. The surgery, like I said, was on August 25th, and when I went in and came out, they told me and my husband that everything was fine. It was textbook, perfect sort of thing. And then they sent me home 2 days later, and on the Sunday, which I guess would be 4 days later, I wasn't feeling good. I was quite tired. I had a lot of pain in my back. I wasn't able to eat very much, so my mother is like reading the hospital papers. You gotta go back, you gotta go back. So we went back, and about 11 o'clock I started throwing up and fainting, and it's a good thing we went back. They left me in a nurse's station from 11 o'clock until 6 o'clock. No communication of any kind, just dripping an IV in me and painkillers, and that was it. They claimed they're waiting for the surgeon to contact them. I don't think I believe that, but whatever. And the woman that put the IV in, she put in an infant IV. So when I was going to surgery, I kept pointing out to people, this IV is not right. And they just kept dismissing me. And when they took me into surgery, they said that I pointed out to the anesthesiologist, and he said, this is not an appropriate IV. It's an infant IV, and if he needs to resuscitate me, it's not going to cover. It's not going to work. So I'm glad I brought that to his attention. Every department that I went to, I went to CAT scan, ultrasound, x-ray, the place where they put the tube down my throat, surgery, every department I went to, even the orderlies and the recovery room where they supervise you before they take you to your room, every room, every staff had complaints about something, and it was very negative, very poisonous environment. It was terrible. This is Humber River on Finch and Jane. It's terrible. Food, I'm at the puree stage, but I find it's just easier for me to puree the food in my mouth than pureeing it in a bowl. It just doesn't go down well. So I've had things like crackers and cheese, lots of homemade soup. I've had some rice and chicken. I'm doing well with all of it. Nothing is sticking. The doctor asked me if food was sticking, and I said, no, I don't think so, but what would that look like if it was? And he said that I'd be throwing up and feeling nauseous, and none of that has happened, so I take it as a good sign. I'm really, really practicing the chewing, chew, 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 chew. I feel it go to the back of my mouth, and then I push it forward and chew, 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 and push it forward. I do it like at least 3 times, and check it out with my tongue to see if it's small to go through. Keeping in mind that the size of the new hole is like the size of a dime, while I'm feeling around in my mouth for what's going on. And gas. I'm very gassy. I think the gas is causing me more discomfort than anything else, even more than the JP tubes. The surgery, the first surgery I went in, I came out, they said everything was fine. It wasn't. The next surgery I went in, they said that they found an abscess, and I don't know if they found a hole at that point, but definitely by the 3rd surgery, which was 40 hours later, they were talking about a hole. And the head of bariatrics went through the videotapes of the surgery to see like what happened. He was quite upset that I went in like 3 times in 5 days. I don't know who dropped the ball, if anybody did, or it was just what it was. I don't know. I'm definitely going to ask for clarification on that. I'll show you my scars, what's left. And I had to buy a wireless bra, and given that I'm not a small woman, I can't wear just any wireless bra. So I've got a sports bra on, and the reason is that I have an incision that's quite high, and the wire from the other bras doesn't just sit on it, it like rubs it, you know. So it was getting pretty raw and it wasn't healing very well, so I had to buy a sports bra. Oh. So I'm just going to pull it down from here. Oops, I'm always getting hooked on these things. Okay, so here's the one getting attacked by the bra. So there's one here, there's one hiding in here. I won't show it because I respect those that can't handle it. There's a little incision right here. I'm not sure if that was the 2nd or 3rd surgery. There's this one here, which was pretty bad, but it's doing very well now. And it had blisters above and below the hole initially. I know they reused it at least once. So this is the one that they used every time. It's quite thick and hard, and there's a big scab. And when I move my muscle, I know it's kind of hard to see in this angle. I don't know if you can. No, you can't. It dimples in. And then there's this one here. So there's 6 holes total. I think 5 is the standard, but given that they had to go back, that's what it is. So I want to put that on there. There we go. Woo! Oh, and these are my bags. This yellow color is normal. It's healthy. But I've got to milk these wonderful tubes coming out of me. Aren't they great? Like I said, I have a nurse that comes in and helps me with those. She comes every other day, so I still have a responsibility to squeeze the tubes. They call it milking. It just clears the tubes and makes sure there's no blockage, and it's wonderful. Anyway, hopefully I haven't talked too long. We'll see if this one works. Bye.